This is Susan Van Zandt, and I'm going to be doing my history and physical. So we'll just go over the beginning. This is a 4-year-old Caucasian male with molluscum contagiosum infection for about 7 days now. It first appeared a year ago and has progressively cleared up without medical treatment, but there is some redness, swelling, and irritation under the right axillary region. Previous medical history, denies any chickenpox, scarlet fever, or measles. Diagnosed twice under the age of 1 with RSV and received antibiotic treatment, nebulizer treatment with albuterol and Tylenol at home without hospitalization. Reoccurring ear infections from the age of 6 months to 2 years requiring outpatient surgery for a tube placement. Tubes are currently in and do not require surgical extraction. The child is up to date on all immunizations, including the seasonal flu. In 2009, operations include a bilateral myringotomy at Tulsa Spine and Specialty by Dr. David Hall in Tulsa, Oklahoma. Did not require any inpatient admission. Denies any schizophrenia, autism, manic depression, or psychosis as far as physical psychiatric illness is concerned. The labor and delivery portion, delivered by C-section at 38 weeks with no complications. Went home 48 hours post-operatively and did fine. The birth weight was 6 pounds 3 ounces, 19 inches long. Take-home weight was 5 pounds 3 ounces and was breastfed for the first 6 months of his life with formula substitution. Current diet consists, a normal breakfast would be cereal with 2% milk or oatmeal, sandwich with peanut butter, deli meat with a vegetable and fruit for lunch, family-style dinner with protein, vegetable, starch, and fruit with milk for dinner. Encourage 2 snacks between meals, which include carbohydrates or vegetables, and at least 8 ounces of water a day with juice used sparingly. Candy is discouraged, although not completely avoided. Child appears very well developed and healthy. The child, as far as exercise is concerned, is not on an exercise plan, but plays outside 3 to 4 hours a day, riding bikes, jumping on the trampoline, or running. He also goes to a Mother's Day Out program for 8 hours, 1 day a week. No known drug allergies, no known other allergies. Current medications include children's Tylenol PRN for fever, children's Motrin PRN for fever, bacitracin PRN for cuts and scrapes, a multivitamin daily, and a children's nighttime brand herbal tea PRN HS. Family history. This is the only living child. There was a previous miscarriage at approximately 6 months ago at 6 weeks. There was no surgical interventions needed. Father is 30 and in good health, no current or previous medical conditions. Last wellness check was in 2012. Mother 27 and in good health, no current or previous medical condition. Last wellness check 2012. Last pap smear with breast exam negative 2012. Paternal grandmother has a history of high blood pressure, which is currently controlled by oral medication. No other medical history. Paternal grandmother, sepsis related to breast implant surgery requiring hospitalization and antibiotic treatment. No other medical history. Maternal grandfather, hypertension and diabetes. Both are being controlled by diet and oral medications. Paternal grandfather, hypertension, obesity, and hypothyroidism. Other family history includes cancer, hypertension, hypothyroid, heart disease, and diabetes. On the maternal side, cancer, hypertension, and hypothyroid of paternal side. Both sides deny any mental health history. Social history, mother denies any continued exposure to secondhand smoke or alcohol, both during the pregnancy and after. The child has been in good health overall for the past year with no illnesses besides occasional seasonal allergies. There are bumps on the right aspect of the child's trunk and axillary region that are flesh-colored, small, and have a depressed white center. Child states that the bumps are not painful or itchy. Mother states that the bumps have spread in diameter and have never been reddened until this last week when one became extremely red, swollen, and warm. No other lesions, rash, or infections at this time. Mother states there's no drainage, pain, or tenderness within the ear. Last hearing test performed in 2009 without complication. Mother states that the child does not wear glasses and has no difficulty with vision. The child has never been to the optometrist or had a complete vision eye exam. Mother states has seasonal allergies and has a runny nose with clear drainage and sneezing associated with it. Denies any pain, swelling, or bleeding at this time. Denies any sores, lesions, sore throat, difficulty chewing or swallowing, or ulcers. Denies any cavities at this time. Full set of deciduous teeth. Last dentist visit 2012 for routine cleaning. No abnormalities. Neck denies any pain, swelling, or abdominal growth. Full range of motion. Breast denies any pain, swelling, nodules, rash, or drainage. Cardiovascular, mother states that there has never been any heart complication. Denies chest pain, palpitation, shortness of breath, irregular heart rate or rhythm, or arm pain. Respiratory, previous history with RSV. Last episode was in 2009. Denies any history of shortness of breath, wheezing, asthma, cough, or congestion. GI denies any constipation. Usually has 2 to 3 soft form stools per day. Denies any diarrheas or emesis. Abdomen denies any pain, bulges, or redness. Multiple flesh-colored bumps on right aspect of abdomen and chest spreading to axillary region. Bumps on abdomen and chest are not painful, itchy, red, and warm, or draining. GU, completely potty trained and denies any recent bedwetting or accidents. Denies any burning, foul odor, or bleeding during urination. No history or UTI of kidney disease. Hematology denies any blood clots, bleeding disorders, or anemia. No history of blood transfusions or sepsis. Endocrine denies any diagnosis of diabetes or thyroid disease. Musculoskeletal denies any pain or weakness. Denies any limitation to exercise, movement, abnormal bone growth, or muscle tone. Neuro denies any headache, light intolerance, or vision changes. Mother denies any behavioral changes, agitation, confusion, mania, or psychosis. Mental status denies any denies any confusion, mania, depression, or mental changes. Emotional denies any unusual crying, depression, behavior changes, or nervousness. Rectum denies any hemorrhoids, rectal pain and bleeding, or incontinence. Completely potty trained without accidents or nighttime bedwetting. So as far as the physical exam goes, we will start that in just 1 second.